I want to take a minute and say thank you to Monica for her kind words. It's been wonderful working with you, and I look forward to continue working with you to make nursing school easier and easier as you go instead of getting more difficult each semester. For those of you nursing students that don't know what she's talking about my Silver Bullet study system, which is the best way to study in nursing school. This is the time of the semester that I get a ton of adult learner nursing students coming to me saying, hey, I am doing all the things I know how to do. I am studying hard. I'm reading the textbook. I'm copying my notes, looking through the PowerPoint slides, but it's just not getting me the results I want on the exams. I still get to the exams and it's like I don't know what the question is asking, even though I thought I studied everything I needed to. I thought I knew it before I walked into the exam. It's because you're probably using passive learning strategies instead of active learning strategies, which it shocks me how many nursing students have never even been taught what those things are and what the difference is and how to use the active learning strategies in nursing school. In fact, a lot of nursing instructors will inadvertently advise you to use techniques that are passive learning strategies, so they're definitely not going to get you the results you want. And they just do it because they don't know the difference either, which is where the Silver Bullet study system comes in. I developed it over my 15 years of nursing tutoring experience. It is a 4-step process that mimics the way experienced nurses think so that you can think that way too. Helps you identify the most important information even before you know what that information is, because maybe you're brand new to nursing school, just like Monica. Helps you organize the information so that it does not feel overwhelming to you and you know exactly what you need to study and what you don't have to worry about. And I think most importantly is it connects the dots and it guides you through how to think like a nurse about any topic you have to study in nursing school. Because the secret, like the dirty little secret in nursing school, is that you're not being tested on what you know anymore. You're being tested on how to think about what you know. It's the higher level testing questions. It's what really makes it feel like you don't know what the question's asking, because they're not asking for what you studied, they're asking you to think about what you studied. And just like any skill, if you haven't practiced how to think about it in your study time, you're doing that for the first time on your test, you're not going to do that great at it. So it's only to be expected that you're struggling and getting borderline or failing grades. Does not mean there's anything wrong with you, does not mean there's anything wrong with your brain, does not mean anything about your future as an amazing nurse. All it means is that we have to get you using some better study strategies so that you can get better results. And if you want an intro to the Silver Bullet study system, if you haven't seen me talk about that before, if you're not already one of my tutoring members in my group tutoring membership or one of my one-on-one tutoring members or anything like that, you can go to my profile link and get a free 10-minute overview video on the Silver Bullet study system. Even comes with a free download that you can print out and keep in your textbook to remind you.